Our next speaker is Barry Sharpless from the Scripps Research Institute. And Barry has been a very long time collaborator of Palmer's, working on click chemistry to make some of the molecules that Palmer has worked on. So the title of his talk is Click Chemistry, New Directions.
I'm here to talk about my friend Palmer and some new chemistry. And I first have to tell you something that I've been thinking about in the last half year quite a bit, and how the fortunes of this thing called click chemistry developed. And, you know, things start out not great. Sometimes you make a choice to go in a direction, and it wasn't it wasn't going to survive, it turns out. And MG and I put this together before he left. We kind of felt like Palmer and Kevin Kelly, of all people, got click chemistry into a sweet spot, which it wouldn't have found, and it would have faded away. Anyway, if you don't know what click chemistry is, that's good. That means I like it when people use something without knowing where it comes from. It means it's a kit that works. And that we all need kits that work. And I don't look down on anything in biology for stuff that works. I mean, we all need, when it gets tough and small and messy and slippery, we need everything we can get. First, I'd like to write something from MG, who I think Palmer is a man like Palmer, not as talented perhaps, but he's a mensch. He likes people. He's a good research director. He teaches students as well as solves problems, just like Palmer. Whereas I tend to go after the problem and throw the whole team at it, and they go crazy. Over the years, it's not been an easy time. It was known as the Sharpless Lab of Doom for a long time. Okay, MG said, if I were there, I would say this about Palmer. Palmer is a study in contrasting areas of excellence. Pharmacology is all about molecules, but few pharmacologists really have an affinity for them. Palmer-Taylor is the exception. A truly chemistry-friendly pharmacologist ready to gamble on the power of bond formation, rather than on received wisdom of the herd. He is also the rare transformative scientist who is also a transformative administrator. I often point to UCSD's Skaggs School as an example of what a creative and an energetic administration can do to build world-class strength, in a very short time. Grateful thanks to you, Palmer, for one who has been privileged to collaborate with you and learn from you. He's now chairman at Georgia Tech. It's hard to live at a place where you don't get any salary, you know, unless you have a chair. I mean, these people like institutes like Salk and I don't know, in Scripps, we've got to get funding somehow to pay half people's salary, otherwise we won't survive. And then there's another inventor here. Maybe I should go into the story a little bit and read from Luke Green, because I also wrote him recently wondering about what he remembered. The QAC reaction was the one that made click chemistry get noticed broadly. But it started with the idea of MG and I after reading a book by Kevin Kelly. The book is called Out of Control. Let's see if I can get started with the right slides here. Is it up there? Okay, I want to just make sure that's the first slide. I think this is the wrong lecture. How is that possible? Yep, it's the wrong lecture. But I had trouble. I got a slide of a screen that's over there somewhere. I can't. We've got an expert in Macs here. He can get my screen back. This is the lousy El Capitan program. It's not working too well. I need just maybe to unplug and get started and pick the right lecture. Okay, thanks. Now, I don't even think this thing, okay. Yeah, this is it. And go to well, the click chemistry had surprises, and so when it started, it was just a idea for modularity, because life is modular, using about 35 building blocks to make the machinery that really counts, and it's pretty big. So you can't afford to make amino acids and sugars. You have to try to recover what you can, and that's why life is so modular. I think that's very obvious to all of us. And I mean, we can eat the grass, and the grass can eat us, you know. Everybody can eat everybody. The parts are the same. I mean, you know, it doesn't quite work out for the grass to eat you, but they'll absorb your juices. And now, I guess I have to get used to this. Okay, so back to the first part. This was the in situ inhibitor that we made with Palmer and got inspired by. And that comes back to an endpoint about electric fields and interfaces, where life apparently was born, probably, and where most of this chemistry that we're doing always works best. It's not life chemistry, but it has the same needs. I think copper out of that fell from Luke Green one day, just almost overnight, after we found out from the great X-ray team of Palmer's in Marseille, Yves and Pascal, who were here, and they told us, they showed us the structure, and it sort of triggered Luke's doing an experiment the day before he left for England in his job with Roche back home many years ago. One experiment, and it worked 100% in 15 minutes. He didn't find that till the next day, because he didn't just put it on, put a control on with no copper, and he came back and then he had to check it the next day to see how fast it was. Next came ruthenium, which was partly out of China with Professor Jia from Hong Kong, and that did the other way for triazoles. But it's nothing like the copper reaction. And then finally comes this on water, which they all like, and that led us to this curiosity about the interface and an idea from Marcus I'll come back to. Let me read about, because Luke discovered that, let me read a few things in this description of his memories of that discovery. Warren Lewis was here, and that was important, and he wandered over, I think, first to see Palmer and Zoran. Okay, so Warren, we were having a lot of trouble. They were trying ideas of in situ things with other groups, actually, it turns out. I hadn't remembered that. And then we were doing our own idea, which we got after reading Kevin Kelly's thing, and you'll see that in a minute. But Warren took up the IC50 determination of this, what was so potent an inhibitor that we couldn't deal with it. We didn't know what. We probably thought it was a mistake, and which after preliminary experiments became fortunate. Fortunately, we had a world expert on acetylcholinesterase just down the road. I say across the road. This is when he went to Palmer and Zoran Radish. Palmer's lab was really helpful. We were total novices, but they took us seriously. The pages cut off. The compound, such a potent compound, they had to get the off rate using herring sperm DNA to stop the compound rebinding when it this is terrible. I just might as well read it right. Oh, damn. Okay, I'll start again. Experiments became clear that the compound was a bit unusual. Fortunately, we had Palmer and they took us seriously. They had a bit of a creative, be a bit creative in order to measure associated this is hopeless for a guy like me. Okay, the associated. They had the reach even for them. Guys like George Whitesides couldn't believe that I could get a femtomolar measurement on an inhibitor. And he was right, of course. But that was kind of George speaking. And so Palmer, they got the off rate, everything was done. But the main point was they were excited about it too. And they wanted to do live tests in mice to see what it did. It didn't get in because it had an ethidium on it. Well, I'll show you that in a minute. But from there, Palmer and MG and I and others in our group, we had some fun over the years. And we've done other projects together on nerve gas. But hopefully we'll have some new ones because we got something really, really like the in situ. Because the in situ gave you a clue that was so powerful. Let's try to go through it quickly. And there is the team. Hartmut Kohl was involved at one point, but there's the original team, our original team from UCSD and Marseille. And MG, Valery wasn't involved till till later, the copper or the enzyme. But then we have other chemists at the time that were there. And Roman, I think many of you might know, he's gone pretty much into biology as an expert on in situ type of chemistry. Strips Graphics sells things, such a tremendous graphic. Mike Peake, Richard Lerner made a lot of, and all the people made a lot of mileage out of these graphics. This was acetylcholinesterase rising from the ocean, just to make it for the cover of Angewandte. But you'll notice this was our first effort. Flavio and Zoran and others had modeled this into the cavity, but we assumed it was going to be a trans triazole. So that's the wrong structure, and it wasn't until the X-ray came, almost a year later, I think, from Pascal and Eve, that we suddenly realized, whoa, what's this? Because it's the minor isomer if you do it thermally. And we think of this now as hijacking enzymes to serve for once as molecular scale reaction vessels, because man is doing things by whatever we think we're doing by statistical mechanics and muscle power. I mean, most of us use our hands, and everything's F equals ma. Really, you got to really have a good history and a civilization to get all this stuff implied that we are able to do, I think. And then comes this book by Kevin Kelly. I think it's still worth reading. Out of Control. It's not about hippie. He lives in San Francisco, but he's 19 years in Asia as an Irish only child from New Jersey. His parents were very generous. He educated himself in India and Asia, and he paid his way by taking pictures and sending the magazines back home. But he's one of the world's most original and unfettered thinkers, I think. He knows science, he taught it to himself. The idea of out of control is life. If you're not out of control, you aren't much. We're in control, but we're kind of misguided control when it comes to understanding what the Earth is really about, I think. That's my read. And here's one of the great things that we read. MG and I both pointed to that phrase. It was in a chapter on God games about halfway through the book. And I don't know if you're what age you are, but you remember God games were a Sim City, Sim Earth, you were God. Well, the first rule of God games is you have to relinquish control. I mean, that's the rules, right? We're trying to feed the system and see how it grows on its own under rules we think we might understand. And so you have to let go to win. And that, MG and I decided, we both reacted the same way. I don't know why we did that, but we said, everybody makes a finished potential drug. or candidate. Isn't that asking a lot of our brain and our knowledge of what's really going on? Why can't we just let the enzyme maybe do the last step? And of course, people have done that several different ways. The azide was the most dramatic to date, but it was the most difficult too, because it was 3,000-year half-life. We can estimate it and sort of measure it at a higher temperature and back off half-life for the reaction at that concentration, where we incubated it in Palmer's experiments. It was micromolar concentration, and it would have been half over in 3,000 years. So the enzyme had a long, long way to, it could show its stuff, and it could only have worked if it had a lot of stuff to show. And I think even Palmer, we believe it's an electric field that flashed through that thing and canceled the dipole. And maybe it was the most dramatic of all. And an accidental tourist type enzyme that showed the most dramatic electric flash effect that may come out. That's a new phenomenon coming out of many groups, but Stanford, Steve Boxer is leading. Anyway, we took Palmer's, we had always told him the idea of using the top piece from Palmer before we ever talked to him. That's ethidium. He was the one who found, it was a major breakthrough to find an outside pocket blocker as well as the tacron down inside. So all we had to do was put these pathetic cycloaddition 3,000 half-year life and put them to see if they grab each other. We did it with different, well, these were made by Luke Green, and they're combinations, they're not all ethidiums on acetylines, there's ethidium on azides. It was a representative, and we looked, Zoran looked carefully at the ways the thing could fit and how long it should be, but we tried to do unbiased screening. And what happened was the product formed, and eventually it was X-rayed, and it was only these two that coupled. Later we found if we looked better, we got better at this tracking with them. Mass spec was getting better by the minute. As you know, it's still getting better by the minute. It's amazing what we can do with mass spec these days. So we found the product, and it was, these two had gone together. Now we know it's syn, so I'm just showing them as they would be before they react in the pocket to make the triazole and give off about 70 kilocalories of heat. 70 kilocalories of heat makes that enzyme shake for a while. But then it comes back down to earth and it's frozen, gets frozen in a conformation that it stays in. And it's not a happy, I mean, well, I think McGammon, my friend, will give a lecture, and he helped us here, Palmer and Zoran, by estimating dynamics, and he had the protein up 4 kilocalories up the energy surface of its normal conformation when it's apo. So femtomolar, you know, it's sort of what you expect from multiplying these together, but you rarely get that. So it was 77 femtomolar. That was the first inhibitor I technically ever made, and we didn't make it. The enzyme did. Okay, 77. So let's see. Oh yeah. So this would be the first paper no. This would have been, yeah, the first paper was in, no, was that the first paper? I thought it was, oh, I guess it was the first paper, because I talked about it for my Nobel Prize speech. I was already way out of asymmetric chemistry by then, and so that was kind of a surprise to them, I think, but I loved it. And so there it goes. That guy reacts with that one. And yeah, makes, oops. We just use this. This is the way it looks if you get Zoran to pull it out and make it look beautiful. It's got the triazole in the the syn triazole right there, and it's displaying things which you won't see too easily. But up here is where the amazing thing happened because of that monster stacking thing, ethidium. And, okay, now, this is how it looked when it was extra. This is its anti-triazole. The anti was still like 400 or 500 femtomolar, not a bad inhibitor itself. And this is what we'd always seen. There was this, I'm getting too slow, I have to speed up. This is the tryptophan in the wall that is the recognition motif for these quat salts and as a stacker. And here it had been pulled out of the wall by the syn, so that now it was stacking more between the, I'm sorry, that's tyrosine, and this tryptophan came from out here, and it just sandwiched it. And it was stuck there because it took 2 weeks to offerate. And that shows you what it looks like. The holes are different, and there's that pseudopod sticking out. So when you watch this little movie that Zoran made for all of us, there's the channel. There's serine down here for the active hydrolysis. Here comes tacrin with the azide with the acetylene on it, I guess. You know, azide on it, and you see these aromatics are lining the pocket. This is the acetylene, which is now going to add. And what it does, all that jiggling around, was to show what happens when the tryptophan comes in and out of the wall. Sort of, I think Bill McGammon said it was a gating type of situation. He thought it does turn over very fast. It may not be able to do that. It has to do that at least 10,000 times a second, although it never reaches Vmax. But still, that's a pretty nervous tryptophan. And what it's now, it's got the ethidium, and there's tyrosine 72, and that's what the X-ray shows. Well, I just grabbed this morning on the internet, and you know, lightning is very potent and kills. And it turns out the electric fields that are around in these, Palmer and Pascal pointed out to me, there's a huge electric field down in that hole, 20 angstrom hole, where that, which is pulling that positive charge down that hole real fast. And so dipoles are common. They're executed, of course, by polarity and polarizability and proton transfers, partial transfers. But I think the interface has a huge, very thin electric field. And that's what I mentioned to you at the end today. Okay, there's another kid coming down a slide in the rate humidity and his hair sticking up. Here's the beginning of what this electric field idea came from. And it worked back its way back to this cycloaddition of femtomolar inhibitor. There's nobody catalyzed the cycloaddition, except that cycloaddition for the syn brings in about a 5 3/4 dipole, where there may be only 2 in the A side. So you've got a huge dipole. That's the only barrier, really. And you can hold them together, but it's not going to help you in terms of enormous kick unless you can cancel that dipole by a flash of electric field sweeping through. And that seems like a really good story for them, this work. That's what's meant. We can't prove anything like that, of course, but it's discussed in the new paper that just came out in JACS. See this stuff here? This is red oil. It has 1-to-1 very exergonic reaction. It's got a diazocarboxylate and quadricyclane. Or no, this one doesn't have the quadricyclane. It's better with the quadricyclane. That's made by the government for making airplane engines go faster. It's norbornene photolysed. It's almost like prismane from benzene with 1 extra methylene. And it burns really well. And it's dense. So I don't know. They gave me a gallon of it a few years ago. I still have some if anybody wants to try it. For their jet car. Water, life's matrix, is also the best solvent for all this stuff. And here we have an ene reaction. Again, this is this diazo compound, which does Diels-Alders and Eanes. And this one didn't go very fast. The one that goes up to 500-fold, literally at 0 degrees, is the quadricyclane. But let's just look at this one. It's a red oil. Pinene is about 0.8 or 0.76 on the density scale. This is denser than water, but the net here is float, pure water. And then we stir it, so you can't see much. I was hoping to have a Schlieren diagram today, a Schlieren technique. I need to get help from the engineers over here. But if you look at you see that red interface there? It's on top, but if you look into that interface closely, when you put it together, you layer it on, there is whirling of heat coming out into the colored phase. And you can see that by density change. You know, you can even see it in plain water by density change. So we're going to turn it around by putting a little carbon tet. That's what I wanted to do today, but I didn't have time because of my lecture fiasco. This is a thing that will then show proper work, because the water on top will take care of the heat. What it's doing underneath is kind of half-assed, right? I mean, it can't. So, but it's on top, and I think this reaction can vect itself to perfection, and you can just wait and let it do it itself, no stirring, because we know the stirring is not. You'd think it'd have to be massive stirring, but it saturates on the stirring pretty fast. I think everything is diffusion controlled and exchanging products and stirring materials at the interface. But the interface has the free protons. I think I'm going to have to foreshorten this, because then I ran into Rudy Marcus in China in 2003 or 4. And Rudy was the only guy who ever looked at this 30 mils of red oil on water and got interested. Only smart person, I mean theoretical person, which I consider really smart. And like he went and had a postdoc calculate it before we got home, and because he thought there was something there from McCammon and his professor's 1986 paper on these dangling free protons at the interface of water. And it fit perfectly for the calculation, and I was so very excited, because it just more exciting. A theory that really is potent, like as a DNA, I mean, that's more important than any manifestation of it, right? I mean, we forget that we don't have to have a recipe for doing something. A theory that stands for a long time, they don't all stand forever, but it stands for long enough to keep you on the right track in science. They're always more important than any observation. There's the paper. It was not cited at all for 5 years. I don't know. And now it's got 300 citations. It's coming up pretty fast. Rudy doesn't care. He had never even looks at citations. Rudy Marcus is a real scientist. He's just curious, and he gets so excited as a kid. He's 95 now. I was just with him in China again. And we didn't get a chance to talk to our colleagues in China. We went from 2 places, and they barely got a word in edgewise, because Rudy kept interrogating me about this thing. And I told him it had an isotope effect with deuterium. But then he said, oh, let's forget it then. You can't have an isotope effect. These hydrogens are not transferring. They're just pushing. They're free, so they get 1.25 kcals apiece free, but they aren't moving. They're just hydrogen bonding. So you don't expect an isotope effect. Well, I went back and the student checked it again, and indeed there was no isotope effect. Just a trivial one that Rudy's calculations said there would be. Okay, this is what Rudy's theory is. Of course, in water, like we have in our sink or in a spoon, we should always remember that it's not curved. I don't know why they curved it. It's just flat. But what happens is water has bulk miles deep. It has bulk around the world. That bulk phase isn't very... not much goes on there, I think, except salts and things. Most of what happens in life and water is at the interface, and the price water pays for getting its unhappiness sorted out, and its high surface tension is to leave some protons, about 5 protons per 30 square angstroms is Rudy's estimate. So they're waiting for something to come down. This was Andy McCammon and Peter Ruski's. That was Andy's one of his thesis projects, I think. And they showed with carbon tet and water, it's upside down, but you know, there's absolutely no detectable difference in chemistry due to gravity. Okay, so we can't worry about anything like that here. Upside down, on top, on bottom, that's on water. It's just not in water, okay? That's what most people call this stuff because they don't believe in heterogeneous being powerful. So this reaction goes probably 500,000 times faster than the other reaction, and in bulk, because it goes in bulk, but it has to go very fast to win, right? Because the interface is a little tiny thing. Anyway, he calculated it, and the transition state pulls in a tremendous, coming out of the cycloaddition or the ene comes a lot of density into the backbone of the heteroatom thing, and it needs a huge amount more hydrogen bonding at the transition state. So I think I'll be done here. I just wanted to, yeah, the barrier, just by counting the free hydrogen bonds that you get because of Sakali's entropy estimate of each one that's free is ready to go. It doesn't have to be decoupled from a place where it will be already hydrogen bonded when it's in solution. And okay, 1, 2, 3. And that was the end of that story. I want to show you this newest click chemistry. This reaction is even, if anything, better than the copper reaction. It doesn't need a metal, and it goes, like the copper reaction, it goes at least 100 times and without falling below 99% in favorable total yield. That's a yield to the power of 100. So these reactions are off by themselves. And here's how I got interested in it. It was said to be non-reactive, but it goes out into, but the Achilles heel is water interface. And that's where we first saw things like this. You need the interface, you have water and some triethylamine. It's got basic amines, but it doesn't like amines. It has a very strong taste for phenols. So bang, this crashes out 80% yield. And we've done that with a lot of natural products. It just has a weirdness, let's face it. It can read it can read subtle things. It's all happening at the interface, but that's not the right one. Okay, in this we did then a pull down. Jeff Kelly's been we've gotten a lot of pull down help and in collaborations with Jeff, and he pulls down one protein. And this thing is, we had Zimmerman from earlier, 10 years ago, had made lots of Vancos with acetylines. We took one, put the gas on it, and pulled it down, and I think they know the structure of the protein. They didn't tell me for some reason. I can't believe that, but anyway, we have to start getting better at identifying protein. It's still an antibiotic. I don't know if it's better or worse. It's not good in vancomycin and E. coli because that's gram-negative. It doesn't go in, but it kills over here the Staphylococcus. And that's one more. The last one. That's Palmer's in one of our stories with Hartmut Kolb, and we did a lot on his beautiful enzyme. This is the world's most beautiful starfish, and it captures acetylcholine to be the agonist. It agonists for sodium channel opening, makes us happy in the brain, or it makes us alert. My son's addicted to it. I don't know, a lot of people are or were. And so then we put it in. This was a very good high picomolar with the benzyl, and we saw a tyrosine under the flap. And the tyrosine did grab it, even though the tyrosine wasn't activated by arginines or things. And so it went on that tyrosine. I'm sorry we don't have the X-ray. Todd had to leave for a job in Wyoming, and everybody's too busy to write things up, I guess. I just want to point out to you that the only two reactions in the world that I know of now that will be holding the top, if you have is that QAC, and the thing makes a polymer, the suffix. It's like polycarbonate, and it's probably a 500 mer, 300 mer, and so that's an awful lot of steps. Note without lesions. And that's if things are not polar. Thank again the wonderful faces on the screen and people in the room, and especially Palmer, because facts are we wouldn't have found the copper reaction if we hadn't been tickled or goosed by the sin triazole. So that's Palmer and even Pascal. And then everything after that, well, I just didn't realize that how lucky I was to be across the street from Mr. Acetylcholinesterate. And that's not, this isn't made up. This is a story that I've thought about for years, and it's correct. So thank you very much, everybody, and thank you, Palmer, especially.
Thank you, Barry. Unfortunately, we don't really have time for questions because we have to finish on time. So our next speaker is Andy McKamen, who's from the chemistry department in pharmacology, and he's going to be talking about the role of molecular dynamics in drug discovery.
Okay, well, I'll say again, it's a pleasure to be here to recognize, honor Palmer's tremendous contributions over the years. I've enjoyed not only collaborating with him scientifically, but also working to develop the School of Pharmacy here. Palmer had the vision for that many, many, many years ago, as Dick Atkinson described, and I had a hand in this or that thing as it got going. One was working on the building advisory committee to plan this building, and I remember there was a worry about the budget not allowing for this auditorium, and we talked about how, well, maybe we should go ahead with the rest of it. The auditorium might be a good gift opportunity for some philanthropic type organization, and Palmer brilliantly pulled that off with the Skaggs gift, and not only got the auditorium, but a beautiful endowment for the School of Pharmacy as well. I did volunteer teaching for 5 years of physical chemistry to pharmacy students, which is, if I may say so, a bit of an ordeal, but I survived, and they survived too, and they've done well on their exam, so I guess that's a good thing. I'm going to try to not run over and tell you a little bit about molecular dynamics and drug discovery, the use of these computer simulations of potential drug targets and particularly small molecule ligands. It'll be partly historical and partly some new things. I always like to emphasize that I've done very little of this work, increasingly little as time has gone on, hands-on, but have had the benefit of myriad talented co-workers, and I have to give credit to them, really. The graduate students are, I think they're all people who are from UCSD more or less recently. Some of them have moved on to their own faculty positions. John Mongan, who is my first MD PhD student here, just joined the faculty at UC San Francisco, actually. And others are in faculty positions, are moving on. Almost all the postdocs are in faculty positions now, and there have been a number of senior collaborators for the recent work that I'll tell you, and actually some extremely good undergrads. Peter Sims started with me as a freshman and is now an assistant professor at Columbia University in biochemistry, and Callie Capel and Carlos are both graduate students at Stanford. So molecular dynamics simulation, I think most of you are familiar with the general idea. We start with a structure of a molecule traditionally developed by X-ray crystallography. This is just the backbone path of a small protein, and if you flesh out the molecule with all the side chains and other atoms and decorated with the charges and so forth. You can calculate the forces that are acting on the atoms of the protein in any given configuration by using what are called molecular mechanics functions. They're very simple descriptions of the potential energy of the protein. For example, if you have a carboxylate group at the C-terminus end, amino terminus end, there's going to be Coulomb's law to describe the interactions between these opposite charges that tend to attract them together. You can describe those forces and then turn those forces into accelerations just using Newton's equation of motion, force equals mass times acceleration. And the accelerations can be used to seed a numerical algorithm to step the structure forward in time over as long an interval as you want if your computer time holds out. And typical computer simulations, the first one was published in Nature. I did this as a postdoc with Martin Karplus, who recently got the Nobel Prize for related work. If you run for some tens of picoseconds, you get a somewhat different structure, tens of picoseconds, somewhat different structure, superpose them, and you see that the major changes tend to be at the exposed dangling ends and loops of the molecule. The original simulations were done with a crude approximation of solvent, but modern simulations with computers now 10 or 50 million times faster than the computer I did this original work on. You take your protein molecule and surround it with many thousands of explicit water molecules, and if you're inside the cell, you might have potassium ions and chloride ions at physiological concentrations, and you have a very detailed perspective of the molecule and move this whole system forward in time. Well, the work that I mentioned, this original simulation, was in the late 70s, and at that time I was just moving to the University of Houston to start my first faculty position, and that time was also the time that the AIDS epidemic emerged, and there was a great press on academics to think about whether methods they used could be useful for drug discovery. The NIH in particular started a fabulous program called the Structural Biology of AIDS program. And so I started thinking about, how can we use computer simulations to aid and abet drug discovery. And one of the early ideas was a way to use what we've come to call computational alchemy to describe how changing a ligand molecule which binds to this receptor to make it complex, changing perhaps one atom or group on this ligand to make a slightly different molecule, how that changes the free energy of binding. Free energy, usually we see delta G for the Gibbs energy. This is A for the Helmholtz energy, virtually the same thing. So is there a way we can, say, change a hydrogen to an amino group or something of that sort and calculate whether this is a more downhill reaction, and so this might be a more attractive compound to take to the wet lab and test. In principle, you could do that just by putting this ligand molecule and this protein, say, in a big box of thousands of water molecules and slowly moving the ligand to the binding site. But that will take, in general, a lot of computer time because of the desolvation processes and possible large conformational changes in the enzyme. And one day, while I was semi-dozing during a lecture, it occurred to me that, you could take an alternative route and take this ligand molecule and have it by itself in water, just make this small change in structure, taking the hydrogen atom and making it a little bit larger, drawing mouse ears on it to turn it into an amino group with slightly different charges on the atoms. And there are ways in statistical mechanics by which, if you slowly transform a molecule like this in a computer, in water, you can calculate the free energy change for that process, neglecting the quantum mechanical components of bond energy changing. You can do the same thing for the ligand molecule bound to the receptor and the quantum mechanical things that you're neglecting largely cancel out in these calculations. And then you can use the fact that free energy is a state function, so that free energy changes that go around a complete thermodynamic cycle like this have to add up to zero. That allows you to carry out these two much easier calculations in general, take the difference between them, and that gives you the difference between these binding free energies, greatly simplifying the calculation of whether you might have an improvement or not in binding free energy for these calculations. Well, I was publishing this work and talking about it. At that same time, a group of faculty members here at UCSD were forming what was really the first company with structure-based drug discovery as its core mission. Mel Simon, who was mentioned earlier, and John Abelson. People formed Agron Pharmaceuticals, and they had very good structural biologists from Joe Kraut's group here at UCSD, very good medicinal chemists, very good bioassay people. But they wanted to do something a little different and use computer simulation methods to help guide their exploration of compound space and looking for drugs to treat AIDS infections, in particular looking for HIV protease inhibitors. Well, I got recruited as a consultant to Agron. They actually started their computer-aided drug discovery program with a couple of postdocs. And Agron pretty soon got a structure of HIV protease. It's this homodimer of 2 polypeptide chains with 99 amino acids in each one. The original structure was actually determined by Alex Lodauer at NIH, but Agron soon had the technology in place to determine structures of the protein, bind ligands to them, characterize them, and cycle this process around on a 1 time per week basis, so they could soon move through large numbers of compounds with a structurally guided perspective. They used computational methods as part of their work, although I think they would have discovered the final product that they got, nelfinavir, even without the computations. They were certainly helpful. The strategy they took, they started with a product from a Japanese pharmaceutical company, which was a good inhibitor of HIV protease, but had lousy pharmacokinetic properties, had poor solubility and other properties. So by using these thermodynamic cycle calculations, which one can use to explore solubility contributions to binding, along with experimental studies, they came up with this compound, Varicept, or nelfinavir, which for many years is the most widely prescribed HIV protease inhibitor. And that, along with other compounds from several other pharmaceutical companies, made a tremendous difference in the AIDS epidemic. These are just data for the United States from the Centers for Disease Control. This is the most recent plot that they have. And looking at the red curve here, the number of deaths in the United States from HIV infections was heading up into the many tens or 100,000 people a year. And this is when the HIV protease inhibitors came on board and resulted in a dramatic decrease in the mortality rate from HIV infections. There's kind of a plateau here for a number of years that in some ways relates to what Ada was talking about, that patients oftentimes are not as good at following their therapy as they're supposed to be, and there's a tendency to develop resistance to the existing drugs. The fact that this curve is taking another downward turn here around 2006 and 7 is because of partly the development of HIV integrase inhibitors, which I'll tell you about in a minute. Well, we had pretty good luck with this thermodynamic stuff, and at the same time, I was getting ready to move to UCSD. I mentioned how I was recruited here very effectively by Palmer and Susan, and we were thinking a lot about acetylcholinesterase, and I had the great pleasure to publish a number of papers with Palmer and Zoran and colleagues on molecular dynamics and acetylcholinesterase and correlating it with fluorescence, anisotropy data, and so forth. One of the things that we looked at that addresses something that Joel Sussman was asking about was there's this very narrow gorge that leads from the surface of the enzyme down past these aromatic groups into the region where the active site, serine and other groups are located. And in fact, every crystal structure that I'm aware of acetylcholinesterase, this gorge is too narrow to allow acetylcholine to get from the outside to the inside in the static enzyme. Proteins are known to overcome these things. It's known from the first crystal structure that was solved for a protein, that of myoglobin, that there have to be fluctuations to allow small molecules to penetrate, allow these molecules to function. But we actually did a set of molecular dynamic simulations. Actually, when we did the simulations done before I moved to UCSD, and we put it to work to try to understand this process of how things get into the enzyme. Let me go back and see if I can. This is a very short simulation, just 200 picoseconds, but you get some idea of how at some points the bottleneck gets very, very small. And this is the accessible surface to a water molecule moving down into the active site. For something that's much larger, like an acetylcholine residue, as I say, it would almost never get down there. In fact, if you take the frames and try to move an acetylcholine molecule down from the outside of the gorge to the binding site, the active site region, only 1% of the time is this gorge open wide enough to allow the molecule down. Well, we addressed how this enzyme is able to sustain diffusion-controlled kinetics in this paper here with some statistical mechanical theory. But let me just tell you the bottom line, which is that although this enzyme is closed 99% of the time to acetylcholine, acetylcholine is large enough that it doesn't diffuse away very rapidly. If acetylcholine, the substrate, moves into this vestibule region up near the top of the enzyme, it will stay in that general area for several picoseconds, maybe 10 or 20, 30 picoseconds before it diffuses away. And so although this gate is closed 99% of the time, during that time interval, there's very likely to be one opening that allows the substrate to actually move down in response to the electric field and bind in the active site of the enzyme. So we call this a successfully fully gated diffusion-controlled reaction. Interestingly, if you have a substrate that's just a little bit larger than acetylcholine, like butyrylcholine, that slight margin in favor of letting the molecule slide in is lost. And so we have kinetic selectivity in this enzyme, which is something that's, I think, poorly recognized in the community, but potentially in the non-equilibrium world of biological molecules likely to be important. Since moving to UCSD and thinking about these kinds of motions in active sites, we've gotten interested in trying to account for the dynamics of proteins, not only in the thermodynamics of binding, but in the initial screening of libraries of organic molecules for binding to proteins. And the idea here is, like most of my ideas, a very simple one. I showed you these pictures of a protein with different snapshots a minute ago. A typical docking study in drug discovery to find lead compounds or hits is to take a crystallographic structure, take a library of thousands of small molecules, of which this is just a character cartoon, and move the small molecule around the surface of the protein looking for possible places to bind. The thought here is that maybe since these molecules, these target molecules, are very flexible, rather than looking at just one structure, one should look at a whole ensemble of the different possible conformations. You might find that one of these conformations actually opens up a crevice that allows successful docking, and a compound that ought to be looked at further in the wet lab. So we applied this method actually to the third enzyme that's associated with HIV. Reverse transcriptase is the enzyme that retrotranscribes RNA into DNA and integrates it into the integrase integrates that into the human genome, and then the protease takes the genetically expressed polypeptide chains of the virions as well as normal human polypeptides and makes pieces of new HIV. The reverse transcriptase had inhibitors very early on, like AZT. I mentioned the protease inhibitors. The integrase has been a much tougher target to crack because it's a very large enzyme and probably only functions as a tetramer and maybe only completely active when it's interwound with the nucleic acids. But in 1999, David Davies' group, very good crystallographer at NIH, managed to get a structure of the catalytic domain of HIV integrase with, again, an inhibitor from a Japanese pharmaceutical company bound to it. Davies pointed out that there were going to be problems with this structure as a basis for drug discovery because in the asymmetric unit, there are actually two of these proteins binding face-to-face right at the binding site, so that the inhibitor in one molecule actually formed hydrogen bonds with its corresponding inhibitor in the neighboring part of the asymmetric unit. So crystal packing artifacts were a very big worry in this structure. Good candidate for this relaxed complex method. Take the protein out of the crystal, immerse it in water, run molecular dynamic simulations, let the complex relax, and look for what might be possible binding geometries if you take this ligand out and try docking it in to different snapshots that are developed in the calculations. Heather Carlson, who led this work early on as a professor of chemistry at Michigan in Ann Arbor now, and Julie Shamus was the grad student who did a key part of the work in our biomedical sciences program. Julie suggested that since the original molecule has this negatively charged tetrazole ring down here, and the docking study suggested that you might bind in this conformation that you see here, but other conformations might be possible in which the tetrazole ring is bound in another part of the molecule up in the northeast corner. Julie suggested making compounds that might allow for bivalent binding with the simple naphthalene scaffolding molecule and these tetrazole two wings to make the butterfly. And she predicted that these butterfly compounds should bind much more strongly, much more lower free energy of binding. Well, we published this work, and you never know if people are reading these things, but I got a call shortly after this came out from Daria Kazuda, who's the vice president for antivirals at Merck and Company, and they had a major program to try to discover inhibitors of HIV integrase inhibitors, and they had basically run into a brick wall just by looking only at the crystallographic structure. There were binding phenomena that they just couldn't understand, and when they saw the paper with the possibility of two different binding formats, they went back and looked at their data, and Daria said it was like the lights went on. They completely refocused their program. They published a paper giving credit to Julie's observation. They actually made these butterfly compounds and showed that they bind much more strongly. But the strategy they took was to look for compounds that might bind very well in the southwest orientation or in this northeast orientation. The idea being that if a mutant arose that knocked out binding in one orientation, the other orientation might still be available. The drug might still retain some efficacy. And I won't go through all the details, but this led to the first FDA-approved HIV integrase inhibitor and has had a tremendous impact on people who have been resistant to all other HIV drugs. I'm going to briefly gallop through just a couple of other things before quitting. We've developed recently methods called accelerated molecular dynamics. This is to deal with the fact that if you're moving on the native potential energy surface of a protein, schematically represented by the solid line here, you tend to get stuck for long periods of time in deep minima on the surface. It takes a lot of collisions to boost you over barriers to other parts of the energy surface. John Mongan, the fellow who's on the faculty at UCSF now, and Donald Hammerberg, a brilliant young scientist from Sierra Leone who just got early tenure at Georgia State University in chemistry, devised this accelerated molecular dynamics method by which one modifies the potential energy surface to give a smoother surface for the dynamics to occur on, so that the barriers are lower to move from one region to another. If you do that in a way that you know how much you're changing the potential energy at every point, for example, maybe we define an energy and say, well, we'll change all the potential energies below this energy, and for any energy that's below that energy, we'll move the surface up like 50%. If you have some quantitative way of changing the energy, you can skim over this surface much more quickly with the accelerated sampling, but for every configuration you get, you can correct back to the original potential energy and rigorously recover the equilibrium properties of the simulation, the thermodynamics and structural properties of the simulation. And so we've put this to work in a number of applications. This is one that came out recently in Nature, where people have mentioned in a couple of talks the acyl carrier protein. This is the protein that is important in fatty acid synthesis and a variety of other syntheses, where you have a set of enzyme molecules and this kind of chaperone protein for the growing lipid chain. The acyl carrier protein has to carry this growing lipid chain from one active site to another and release the lipid into the active site, pull it back in, release it, pull it back in. And Mike Burkhardt has some excellent physicochemical data on this. Stella Tsai, a crystallographer at Irvine, has good crystallographic structure. Stan Opella here has good NMR data on this. And it took accelerated molecular dynamics simulations to really put all these pieces together into a coherent story that came out quite recently. I'll just gallop through the rest of these things. I'm sorry, Art isn't here. We've been collaborating with Art's group. We had a nice substitute lecture, but Art's group is actually following up on some accelerated molecular dynamics simulations on the M2 muscarinic receptor that have led to the discovery of some allosteric modulators that have been shown in the wet lab to have both positive or negative enhancing effects on the activation of the M2 muscarinic receptor. We have simulations now where this is a picture where there's solvent water up here, solvent water down here, lipid bilayer, the M3 muscarinic receptor. You can float these small molecule ligands around in solution and run the equivalent of a millisecond time or 10 milliseconds time of simulation and watch at least these smaller molecules move into the orthosteric binding site and back out again repeatedly and begin to estimate the free energies of binding. The big guy still gets stuck, but we're going to get past it. Last thing, a new thing, is constant pH molecular dynamics simulations. All molecular dynamics simulations to date have been done where you assign a protonation state to your ligand and a protonation state to your protein and don't change them during the binding process. Most drugs are weak acids or weak bases. Protonation state changes are ubiquitous. We now have technology for looking at that and looking at the beta amyloid converting enzyme you can see how important that is, because all the experimental work on this, on inhibitors binding to this potential target for Alzheimer's disease drugs, all the experiments tend to be done at 4.5 pH, where the activity of the enzymes had a maximum, but the therapeutic range is going to be more like around 7. And the pH dependence of the free energy of binding is very large. It's not something you can easily predict without doing simulations that allow for the protonation state changes appropriate to a given pH environment. This is brand new stuff, and hopefully will be useful in drug discovery. These are the folks that did the work, and I'll stop there and thank you for your attention.
Thanks, Andy, for a really great talk. We have time for one quick question.
So, Andy, this board is really interesting, the acetylcholine esterases. There's another class of proteins, the ion channels, that have a narrow gorge. And membrane protein crystallographers love to take a single static picture with one methylene group sticking in and saying that it's closed. Have you ever looked at the pores of ion channels to see are these things matching up? Are they really closed the way people are saying they're closed? And if not, do you think the acetylcholine esterase gorge is unique, or do you think that the pores of all these channels will be just as dynamic?
Yeah, I think the pores are going to change quite a bit from system to system. It seems pretty clear, for example, that the pores of the potassium channel are relatively rigid. There's certainly flexibility in there to allow interaction with the potassium ions as they move from one of these carbonyl groups, but there's probably less motion there than there is in the acetylcholine esterase gorge, where in particular you have these aromatic groups that seem to be kind of like elements of a shutter that can flicker around and lead to dramatic changes in the amount of width of exposure.
Have you tried to push ions through and see how, of a channel that somebody says is potentially closed, have you ever tried to push ions through?
Yeah, no, we haven't, but Benoit Roux, for example, at Chicago has looked at that and has gotten pretty good agreement with some of the data on the potassium channels, and people have been looking at sodium and other channels. We haven't actually pursued that ourselves.
Okay, let's thank all of the speakers for a really nice session on chemistry.
And now I'd like to invite the man himself to come up and give us some concluding remarks.
Well, I'm going to start a little bit backwards and acknowledge everybody that has contributed to the laboratory over many years. And I think what you're going to see, or what you should have seen from this presentation, is a huge amount of creativity. And whether it was individuals that had worked in my lab and just demonstrated this creativity after they left, or whether it was the recruited faculty that came in, starting in the Department of Pharmacology many years ago with Roger and Andy, and then going to...
Just keep talking.
All right, then going to individuals that were recruited to the Skaggs School of Pharmacy, like the person right in front of me, Tracy or Peter. And I think there's a lesson here, is that what you need to do are two things. Try to get them set up, and then get the hell out of their way. And it's that combination that seems to work, because there's really ideal creativity. And what one sees is people moving into new areas of research that were completely distinct from areas that they were trained in. And in a way, that's what pharmacology and pharmacy is all about, because it has to be multidisciplinary and have to bridge between the disciplines. And so what we've seen here is connectivity as well as serendipity. And I think I'll give you a few examples of that type of thing. But first, let's acknowledge the many people that have worked on the cholinesterase genes and proteins, starting with the day that I arrived here, and they've been represented by Gabby Amitai's presentation and what Zoran Radic will be talking about tomorrow, but there have been substantial contributions from many of these individuals. We can turn to nicotinic receptors and see the same kind of thing where Steve Symes, Scott Hansen, Ryan Hibbs have given us great detail. Jeff Hirsch has been here. He may talk a bit tomorrow, and Gisela Andrea Camacho will talk about some of our activities as well. Then finally, this area of neuroligands and neurexins, which came about because of this surprising identity of an alpha-beta hydrolase fold protein amongst the neuroligands that Tom Sudoff originally found, and we collaborated with him with those efforts, and that's been very ably represented by Davide Comalenti. Now, a lot of these people said, talked about their origins here and how that impacted on their research. And maybe I should go back to the same and say that there had been people that have had origins on my research activities as well in my direction. And one of the things that I remember when I was a pharmacy student is going through these pharmaceutical chemistry courses, and the other students were largely ignorant because all you needed is a 2.3 to get into pharmacy school when I was there. And some of them had very poor chemistry backgrounds. In fact, the School of Pharmacy had to have its own organic chemistry course because everybody failed out of the chemistry major course. And I found it rather boring. Yet the faculty members were so engaged in what they were doing, and the late Ed Smithman at Kansas, Joe Cannon at the University of Iowa, Morris Kupchan, who was at Wisconsin, had a great deal of influence, I think, just because of the energy they had. And they recognized that I was bored and said, well, maybe you ought to go into some real chemistry courses and learn more. And so they sent me to the adjacent building, the Department of Chemistry there, and some colleagues that I'm sure Barry Sharpless knows well, Robert Alberti, Howard Zimmerman, what was it, Johnson, what was his name, Barry?
Bill Johnston.
Bill Johnston, yeah. David Lamal, in fact, one of the girls that I dated was one of David's girlfriends. And then they sent me into a quantum chemistry course of Joseph Hertzfelder. And I went in there, and you can tell from these pictures, as coxswain of the crew in 1960, I only weighed 115 pounds. And therefore, that picture of them throwing me across the lake is pretty accurate because I was rather light baggage for them at the time. And I can remember going to this quantum chemistry course, and everybody looked old enough to be my father, and I suspect my sitting there was that somebody lacked a babysitter, and that's why I was coming into this quantum chemistry course. The other impact was that postdoctoral advisor of Arnold Burgeon when I went from the NIH to the University of Cambridge. And Sir Arnold became the head of the Medical Research Council, laboratories at Mill Hill after being the professor at Cambridge. And why I was attracted to that was that he was the first person that developed molecular analytical techniques to go in the direction of pharmacology. And he had convinced the Medical Research Council that all of these molecular techniques, nuclear magnetic resonance, fluorescence, stop flow, depolarization of fluorescence, anisotropy measurements are really going to be critical. And I can remember reading a proposal of his that had the very simple line that the formation of a complex between a small molecule and a macromolecule is common to many disciplines of biology and chemistry. And it's only when we begin to consider the fate of the complex that those fields begin to diverge. And indeed, that says a lot, because the enzymologist is looking for covalent changes, pharmacologists are looking for responses, immunologists are looking for fixation by complement, or other entities here. And that was the justification of this unified idea that we have to begin to use modern physical techniques to look at specificity. And I think that's sort of the origins of molecular pharmacology. To some extent, the molecular biologists captured that term at about the same time. I think it's more appropriate to put molecular into pharmacology because the small molecules are the working molecules of pharmacology, and they should call molecular biology recombinant DNA technology or biology instead of molecular biology. Then there were UCSD faculty that had a great influence. Steve Mayer brought me here. I was the first person that he brought into a division of pharmacology that was in the Department of Medicine. Helen Ranney became the chair of medicine, and Helen began, as medicine began to grow, actively resisted the departure of pharmacology from the Department of Medicine to becoming neutral, to finally becoming our strongest supporter of pharmacology becoming the first basic science department in the school. Dick Atkinson has recounted the activities that related to the School of Pharmacy. In many ways, he initiated that in coming to me and said, I had a Vice Chancellor, Harold Tico, that went around San Diego and asked the industry what the university could do best. And Tico came back and said, what these people need is that they're all doing things related to biotechnology, but whenever their biotechnology matures and they begin to think about the products going into man, they have to go somewhere else. In other words, there wasn't formulation and toxicity and those kinds of studies. And Dick asked me, why don't you guys do that in the Department of Pharmacology? And I said, look, all of our faculty have many things to do. They're well engaged in their research. You can't expect them to do this kind of a endeavor. Why don't we think on a larger scale and start a whole school of pharmacy? And indeed, that's where it started. And many of the individuals have been involved, and particularly David Adler, because he could, as a practicing pharmacist, could work with that community, and that effort is what really entailed or involved the start of the School of Pharmacy. Now, I might mention a couple anecdotal things as well. In this, Bill Derwick has mentioned something about that I'm enamored with natural products. And to some extent that's true. And you'll see this little compound there in the middle that's a cyclic diterpenoid called lophotoxin. And I worked with one of Bill's colleagues, Bill Fennicol. He couldn't be here today. But this intrigued me of how this compound, which is in coral, that's a stationary animal, could active and block motor activity in fish. And indeed, if you look closely at that structure with the cyclic ester and the epoxide, you can see how that would could simulate acetylcholine with a positive cationic charge on the carbon and then react covalently. And indeed, the work that we did suggested that it interacted with one of the tyrosines, reacted with one of the tyrosines in that active center. But that said how clever nature was, because here lophotoxin was in a stationary animal that didn't have the elaborate injection system that Toto Oliveira told us about last night, but rather, as it buds off, it had to have some kind of toxin. And if you have to have a toxin and you are an animal that is in the middle of the globe's most perfect sink, the Pacific Ocean, you better have something that's quite lipid soluble, and none of these alkaloids are going to work very well in that regard. And so here is a natural product that intrigued me. Now there are some that didn't ever intrigue me, and I think that many of you that have had an association with pharmacology would know that. Whenever you have to do a tail vein injection of a scared rat, the natural products are not very endearing to one at all in those kinds of experiments. So let me go from there to turn to a little bit of history that relates to the cholinesterase system here. And this really started prior to where natural alkaloids like physostigmine, nicotine, and muscarine were used long before we knew anything about their structure. And with the cholinesterase, the real pioneering efforts were done by Ernie Wilson in the 50s and 60s, who developed the first oxime as a reactivating agent. It was then in the 90s or in the late 80s and 90s where we were able to determine with Susan's efforts and other people's endeavors to be able to get a sequence and use that sequence to clone the gene encoding the torpedo enzyme, which then turned out to be the species that Israel Silman and Joel Sussman and Mikhail Harrell used to determine the crystal structure. Where are we now when we come to 2016? Well, we probably don't need other cholinesterase inhibitors because their limited effectiveness in Alzheimer's disease and other conditions simply don't relate to any of those properties, but relate to the diversity that exists in this degeneration process. And so there would be more mileage in looking at a situation of finding reactivating agents that could serve us and the world well when we have such disasters and insidious poisonings that go on in a place like Syria as well. And so we've been working for many years in this kind of effort, and this is an effort that has gone on with Barry Sharpless, Valery Folkin, Zoran Radic, and others, and trying to develop simple compounds that are oximes that can cross the blood-brain barrier and reactivate cholinesterase as well. And this is a very simple principle because what we've got is just like an amino acid, we have a compound that indeed is a zwitterionic compound that can go from a cation to an anion either through a neutral species, and that will be blood-brain barrier penetrant or orally bioavailable, or go as the zwitterionic species, which may be an advantage to that system. And indeed, if we do that titration, in this particular case, the PKs for the amine and the oxybate turn out to be about the same. And so this then provides a means of getting compounds with the versatility that they may be orally bioavailable, should be, and that will cross the blood-brain barrier and reactivate central as well as peripheral cholinesterase. Now, and so they have these kinds of attributes, and if you go even to a very simple system, like the zebrafish, these compounds will cross the chorion membrane, whereas the classical 2-PAM And those agents that are pyridinium aldoximes will not unless you peel off that chorion membrane. Now, there are other elements of this that we are still studying with Zoran Radek, with Barry Sharpless, and they relate to the nature of this active center gorge. Very related to some of that with electric field gradients. And I think there's another element here that is very important, and that is this capacity to proton tunnel so that an oxime can effectively lose its charge and be a good general base catalyst as an oxime. And so in looking at various mechanisms, I think proton tunneling with oxime-assisted catalysis would be one of the reasons why these oximes will work at neutral pH, whereas if you look at general base catalysis, it's only above that pK that they're highly active. And we've been working on that element as well as this element of the active center gorge and the electric field transients that are present. Now, so in terms of the mechanism, one has to look at the possibility then of how we extract that proton, and that which can occur at neutral pH on the enzyme, whereas it's only that oximate that is a real good nucleophile for general base catalysis in solution. And I think that becomes one of the challenges as we improve upon that therapy. Where are we with that kind of therapy? Well, if we look at oral bioavailability, our lead compound is highly effective orally. 2-PAM is not. And if it's looked at intramuscularly, they have about the same activity. If we look at its capacity to cross the blood-brain barrier, and this is a logarithmic plot on the ordinate, you can see that we can get higher brain concentrations with administration over a period of time. And I think we're on the right track to get appropriate kinds of antidotes that are present here. Now, then the other thing of looking at historical precedents would be the situation with chemical neurotransmission and receptors. And this idea of chemical neurotransmission, as Jean-Pierre pointed out a couple of evenings ago, was really a phenomenon around the turn of the century with Langley and his student Eliot and others that got into this. Yet in this first 70 years, most of what we did with respect to pharmacology were structural inferences that came out of it. We knew there had to be a receptor there, but that one had to do that indirectly. Structure-activity relationships, enantiomeric selectivity, agonist-antagonist relationships of congeneric compounds, and site-directed labeling suggested that was the case. And it was only when Jean-Pierre and his colleagues used alpha-bungarotoxin and Art Carlin and his colleagues worked with affinity labeling MBTA compounds that one had a well-defined chemical entity that then could be proven, characterized to where we are today. And as you've seen today with the many efforts that have gone into Pershing Corget and Ryan Hibbs's efforts that really look like we now will know a lot about the structure of the nicotinic receptors and the most complicated molecules themselves. And for some time, in the absence of a full receptor, we've taken advantage of Tisha Sixma's identification of acetylcholine binding protein. Scott had worked on that and had obtained one in 2003 and had first characterized this. And this has been then not only a template for crystallography, but the kind of effort that we have used in Barry Sharpless's click chemistry here. And I think there are two things that need to come out of this in terms of the ingenuity. It's not only that in situ reaction, because that in situ reaction is only going to give you one small molecule for every macromolecule that you have as a template. And therefore, one had to have catalytic mechanisms or means of synthesizing that compound after its identification, and the work with copper and ruthenium allowed that second phase of that reaction to go on. The other thing that isn't always appreciated is that click chemistry does not require a catalytic enzyme. In fact, this reaction does not go at the catalytic site. And in fact, if you look at this receptor molecule that has no catalysis, what is happening with the click chemistry is that it's going into this binding site here, and we think that this C loop is going back and forth in a nanosecond time frame. In comes the alkyne and the azide, and we can form these kinds of click chemistry compounds that are characterized. And indeed, with Neil Grimster and others, we've seen that the most potent compounds are the ones that give the greatest mass spectrometry yields and have become our leads for work with the chemistry. Now, there's another phase of the chemistry that has come up with M.G. Finn's efforts, and with that effort, one has been able to design new kinds of compounds that I think will turn out to be very useful as allosteric agents, particularly in heteromeric receptors. And these compounds can occupy every one of those sites, and we can get crystal structures, and we're going to talk about that a little bit tomorrow morning. Gisela Andrea will. And I think if we begin to think about heteromeric receptors, where those subunit interfaces, those little places where the yellow is present there, at all of those 5 subunit interfaces, where there's a ligand occupying that, indeed, in the heteromeric receptors, those are not identical, and that then can be an effort that may lead to kinds of compounds that are not similar to the agonists and antagonists, but have a sufficient specificity, much the same as the cone snail toxins, perhaps specificity as agonists that will be selective for the many kinds of nicotinic receptors that are there. So I would like to then acknowledge a last colleague that was going to come and was very capably handled by Gabby Amitai, and that's Joel Sussman and Mikhail Harrow's colleague, Israel Silman. And you can see Israel here with a glass of what Paul Insel calls a lubrication, and indeed, that's the case. Now, I had to warn Israel, because the last time I went over to warn Israel Silman, the last time I went to a retirement party, it was for Joel Sussman. And we had the retirement party in the evening, a little bit of celebration, and the next morning, what happened was that they gave him a new position. And there he was with another position. So I told Israel that once you go to a party and you lift the glass, there are only 2 words that you can use, and that is lo and ma. Never say can, and that means never say yes. So with that in mind, I thank you all for attending this, and I am deeply indebted to all that presented and absolutely amazed at the sophistication of the science that has occurred over a very short period of time, and you will be the legacy of the future. And that legacy of the future, I think, is very bright, not only for UCSD and its School of Pharmacy, but these areas that relate to cholinergic neurotransmission and relate to solving some of our major issues that relate to antidotes and toxicity, effective antidotes and toxicity, but also relate to the major diseases that relate to the development of the nervous system or the aging process of the nervous system. So again, my heart goes out to all of you for the tremendous symposium that you have put on and the diversity of contributions that we have seen in this auditorium. And I think it really does the auditorium and the room great justice. Thank you.
Memory of this extraordinary meeting, all the friendship we have, and the admiration we have with Palmer. So I thought I could offer him a memory of this event, and with a lifetime of about 1 million years, if maybe, which is a medal. And this medal is about pharmacy. He was from a family of pharmacists. He has created a school of pharmacy. He has produced a lot for pharmacy and for humanity in general. And this medal is at the service de la santé for the good of humanity. Thank you.
This is quite an appropriate medal because Dr. Pierre had shown me this before, and it looks like there's a young lady carrying some grapevines, and then on the back there's a balance and a serpent and the equivalent of a bowl of Hygeia, all of which would be appropriate for pharmacy, whether it's in France or the United States. So, thank you very much.